But I do want to jump right into the topic today. And I was glad to see this topic come up on the wish list from past participants, because I think everything you've heard today from a clinical standpoint really is foundational as far as how we care for older adults, right? We're all here from our different disciplines with clinical competencies that we bring into the care setting. And then we're faced with the older adult who brings with them their interests and what their goals are for their care, who may or may not be able to make decisions about their care. They may have some family members who either agree or disagree with them and or you. And so amid that very complex sort of set of moving parts and pieces, you're supposed to stay on schedule and see more and more patients and do it in a very cost-effective way. And, oh, by the way, be really, really nice to them, because the patient satisfaction scores are based on your being nice to them. And what's a key component of patient satisfaction scores these days? Anyone know what people are getting dinged for all over the country?
Pain management.
Well, pain management, yes, and Dr. Dungarani talked about that. But one component is communication. And not hard to realize why. Communication is so down on the list, right? But yet we've got to do it, right? Everyone here who wants to be a caring clinician? We all do. So you can really come here and get your CEUs on that clinical side of things. Well, today I'm going to hopefully help you get some basics about the compassion side. Because really the compassion side has to do with, I'm a professional, I was trained, I know, I have some sense of my clinical world, what's best for you, patient, family. And I really do want to try to get you some very simple and straightforward principles to use as you face different clinical settings. All right? So just from an objective standpoint, we're going to define ethics, bioethics, and what I'm going to term dilemmas. We're going to look at some core principles of making ethically complex decisions in a timely fashion. And then I want to give you some strategies to think about whether you have to make a decision or whether you're in the role of needing to advise someone else to make a decision. And this is true whether you're a physical therapist and someone's not coming to therapy, or you're a pharmacist and they keep messing up their meds, or you're a social worker and they won't get somebody to come take care of mother, or you're a doctor and they just aren't interested in anything you have to offer. It's true across the board. When you're out of sync with what someone's deciding, think back to this, and I think it'll be probably very instructive. What's going on here? What ought we care about? What is the fitting response to what is going on here? I'm going to stop there, and I think I have a couple minutes, right, Farah? Because I wanted to just hear from all of you if you've got dilemmas that in the past have sort of vexed you and wonder whether this construct, what's going on, what ought we care about, what ought we do, does that give you any sense of being able to approach it in a little bit more comprehensive way? Anybody have any thoughts on that?